ही माझी आई. तर यांचं वेट वाढत होतं, त्यांना काही त्रास होत होते, चालताना दम लागणे, झोपीत श्वास रोखणे. आम्ही नगरहून रुबी हॉलला आलोय.
So regarding this patient, she is a 48 years old female. She met me a month ago and primarily due to weight related issues. Age is just 48 years, but if you see her height is 152 centimeters and weight is 125 kgs. The BMI is 55. When the BMI goes above 50, it's a super obese category of a person, and then the physiology of the body totally changes. So operating these patients, we have to optimize them very well before surgery, because their cardiac function, their lung function, their liver function, kidney function, everything is different compared to a normal person. We started preparing her for a bariatric surgery, in which we did a sleep study where it showed a severe sleep apnea. She was treated in conjunction with Dr. Kapil Jirpesar, who is the pulmonologist here at Ruby Hall Clinic, who put her on a CPAP machine. So what this CPAP machine done is improves the oxygenation in the body. Her anesthesia risk reduces significantly due to this. Secondly, we advised her low caloric diet, liquid diet, salads for the last 7 days in order to make her liver light, which helps in our surgery. The deep breathing exercises were taught by the physiotherapy team led by Mrs. Smita Ingle. So the surgery that I am planning to her is a mini gastric bypass, in which we are reducing the size of the stomach and we would be bypassing to the small intestine. She has an excess weight of about 70 kgs, of which she would lose about 70% of this 70 kgs, that is around 50 kgs she would lose in the next 1 year. And we can expect and see significant improvement in her outcome with regards to the comorbidities that she has in the terms of sleep apnea, diabetes, hypertension, and inability to walk, as you can see in the video. So all of this is expected to improve in the next 1 year after the surgery. So now we are starting the surgery. I would be standing to the right of the patient. The camera person would be from the center. This is the assistant surgeon. We have the high definition camera system here. You can see this is the screen, this is the camera, this is the air insufflator, and there we have the energy devices, which that's the cautery and that's the energy device. And the patient has been given anesthesia with the leg split position. And here we have the instrument assembly here, and I expect this surgery to be over in next 1.5 hours.
Nowadays, because of advances in technology, the bariatric surgery has become quite safe. As an anesthetist, we actually see the patient much before we take them on the table. Because of the increase in monitoring technology, or overall we are having the drugs which are very short acting and very powerful, the anesthesia has become very safe for these patients. During the whole procedure, we are monitoring the patient in depth, and it's very meticulously. All the specialties come together, and it is a multidisciplinary approach. Patients do not get any pain. At the same time, we are doing the surgery through the keyhole, so there is no scar on the body, and patients actually do not get any pain.
So in the post-operative care, we have started her on liquid diet on day 1. We have made her walk. We are giving her anti-DVT stockings to circulate the blood in the limbs. She is doing deep breathing exercises. We are giving her analgesics, that is painkillers round the clock. We are hydrating her with IV fluids. Next 5 days, she will be having a liquid diet, which is unfiltered, and then she will have complete liquids for the first 10 days, semi-solid diet for the next 15 days, and then 25th day onwards she will have the regular diet. She is supposed to take some protein, calcium, vitamins do the physiotherapy exercises, deep breathing exercises, spirometry exercises, walk around frequently. I will see her again on 10th day for the sutures, and again at 1 month regarding compliance and long-term follow-up. Bariatric surgical patients are required to come for a regular follow-up, some basic exercises to start with. The psychological factors or lifestyle factors which need to be corrected or modified are explained and taught to them, and they also need to attend the support group meetings that we conduct regularly, so that this becomes an ongoing phenomenon to maintain that lost weight. I am sure this patient will lose good amount of weight and she will be healthy within the next 1 to 1.5 years. Most of her problems, including the sleep apnea, hypertension, metabolic syndrome, including the fatty liver, everything will be cured, and this cure happens in about 70 to 90% of the patients.
Overall, the bariatric surgery has become very safe, and we are doing it in Ruby Hall for almost more than 20 years, and we have excellent results. So patients should not feel scared or should not feel apprehensive about anything. And we have a specialist which will take care of everything during the operation, after the operation. So patients should come openly, patients should get treated and should have a good quality of life.
मी केदार पाटील सरांचे आणि रुबी हॉलचे जेवढे कर्मचारी आहे त्यांचे मी धन्यवाद करतो. नमस्कार.